Hello everyone, I am Dr. Jaya Kanekar and welcome back to Mind Matters. So today we are going to be talking about panic attacks, panic disorder and agoraphobia. So let's begin with panic attacks. Now all of us have been in a situation where we have perceived some threat and we have panicked. So if it is any situation like if you're walking and suddenly there's a gang of stray dogs that starts barking at you, you will panic. Or if you feel that you are going to be in a motor vehicle accident, or if it is any situation where you perceive a threat to yourself, you are going to panic, and that is completely normal to go through a kind of a panic reaction at that time. But when we say it's a panic attack is a situation where the person will go through sudden and overwhelming feelings of fear and dread in a situation which actually does not warrant it. Like, there is no life-threatening situation over here, but the person will go through such terrible fear, like they are terrified as if really there is a threat to their life, and it is accompanied by physical symptoms wherein they will have chest pain, and then they will not be able to breathe. There is shortness of breath, they are constantly hyperventilating, and they are shaking, they are trembling, they are sweating, there is palpitations, very rapid heartbeat. And now in this particular situation, this person really believes that they are going to die. It is that severe, like this person is now convinced that I am going to die, and the situation is such that that's it, I'm not going to survive beyond this moment, this is my last time and I am really going to die. Along with this, there is this feeling of losing control or going crazy, because they are not able to understand suddenly why am I in this situation where I was quite fine a few minutes ago, and now suddenly I am going through this situation where I am really looks like I am going to die, and then there is no sense of control at all whatsoever at that moment. So naturally, because this person feels that they are going to die in that moment, they are going to be extremely fearful and worried as to when the next panic attack is going to come. And because it is not really in response to some threat, now it becomes like a very open kind of a situation that I don't know when I'm going to have the next panic attack. And it is obviously so severe that I think I'm going to die, so I am not going to take this lightly. So they are now constantly worried and anxious as to when the next panic attack is going to happen. Now, so this is how a panic attack will now move on to a panic disorder, which means that a panic disorder is when a person has one or more panic attacks, and there is a minimum time period of 1 month spent agonizing or worrying or being anxious about when the next attack is going to happen. And because of the nature of these panic attacks, which are very sudden and you don't know when it is going to happen, the person now shows certain maladaptive behaviors. So adaptive behavior is how we adjust to any situation, but maladaptive behavior is now we are coping with this situation in this kind of a behavior, but it is not the right way of dealing with this. So that's called maladaptive. So these people will have maladaptive behaviors to this response to this panic attack. So in that, what they will do, now they are going to completely avoid any situation which resembles a situation where they had a panic attack. So suppose this person had a panic attack at school. If it's a person who has had a panic attack at their place of work, now they are going to try to avoid that place completely, or they are going to try to avoid that situation completely. Some people have a panic attack in crowded places. If they have had it in a mall, then this person will just avoid going to any crowded places now henceforth. Now this causes isolation, because the person is not willing to move out of their house, not willing to go out and meet people or do any of the activities that they were doing before. This will then cause relationship difficulties, it causes difficulties at work or at school, because obviously they are not doing their day-to-day activities as they should. They are not able to cope with those responsibilities. Because of this, a lot of opportunities are lost. If somebody is having the opportunity to go in for a job interview, and the job interview is in a place where in the past, in a similar kind of a situation, they have had a panic attack. So now this person is actively going to avoid that situation. So opportunities are lost. And panic disorder, because of this, becomes a very debilitating condition. So the person loses out on relationships, on work opportunities, and basically becomes homebound most of the times because they are so worried about these panic attacks. Now, how do we cope with those panic attacks? So if we go back to my video on coping skills and emotional resilience, there I have outlined certain things that you can do which would help you in the moment, and certain things that you practice on a daily basis which will help you to become more resilient. Now, one of the most important things in that, like deep breathing. If you are used to practicing deep breathing on a regular basis, then while you are having the panic attack, or when you're just feeling to, beginning to feel that extreme anxiety, if you are able to practice deep breathing, then obviously you are going to be able to reduce the scale of the panic attack, the intensity of the panic attack will go down. Similarly with relaxation techniques, with mindfulness or other forms of meditation. These are all helpful when we are going through intense anxiety situations. And of course, if medications are very helpful in these situations. So if you have these symptoms, and if anyone around you has these symptoms, then please do meet a psychiatrist or encourage them to meet a psychiatrist, because these are conditions which are quite debilitating, which can completely ruin your active life as it is. But these are also very easily treatable. If you meet a psychiatrist, if we start the medications, and if you complete the course of medications as advised, then you will get relief from these symptoms, and you will be able to resume your normal life as it was before the onset of these symptoms. Okay, so please do understand that these conditions, even though they seem very debilitating, even though it feels like you cannot do anything about it in the moment, these are treatable. And if you seek professional help, then definitely you are going to get better. Now coming to agoraphobia. Agoraphobia is this intense fear or anxiety of being in crowded spaces, or in being in vast open spaces, or being in situations where you cannot escape easily, like immediately you cannot leave the situation, or situations where help is not immediately available if you have a panic attack, or if you have any kind of intense anxiety. The likelihood that somebody is immediately going to be able to come and provide you with some help is less. So if any of these conditions are met, then the person is going through agoraphobia. Now most of the time panic attack, panic disorders continue on to agoraphobia, but sometimes agoraphobia and panic disorders can also come on separately. So a person may not have panic attacks but may have agoraphobia. Now when we talk about agoraphobia, or we talk about being in situations where the person feels that there is no help available, these like when we consider it on a general scale, we will say, okay, what are these kind of situations? Maybe if you are really in a problematic situation, it is night, you are in an isolated place, and now you don't feel that any help will be easily available, then yes, you might panic or you might be worried. But for a person who has agoraphobia, it may be very simple day-to-day situations where we will not even consider that these situations are threatening in any way, like being in a long queue, or being seated in the middle of a long row, so in classrooms or in theaters, being in a crowded mall, or being in a lift, or being in an aeroplane. Now these are all situations where there will also be a certain amount of perceived threat for everyone. Like if you are in a crowded space, what kind of a threat would you think of? You would say, okay, there might be some pickpockets, or somebody might hurt me, like they might stamp on my foot or something like that, I might get pushed. These are the kind of threats that you will think of. But the amount of anxiety that the person with agoraphobia experiences is out of keeping with this situation. Like they will not think about these kind of things. And so the amount of anxiety that is experienced by the person who is having agoraphobia is way beyond what is the perceived threat. So if I am worried that somebody is going to stamp on my foot, or somebody is going to steal something or anything, I will be anxious, but I will be anxious in relation to whatever is the threat that I perceive. But somebody with agoraphobia is going to experience that anxiety way more, and that will ultimately lead them to completely avoid the situation. So obviously now these are very general kind of situations and they cannot be avoided. So what happens now, this person completely becomes homebound. They stop going out, they stop meeting people, they stop getting into situations where in any way there can be there is a chance that they are going to be stuck in that situation, or if somebody is not going to immediately be available to provide with them with the help that they need. In some patients, the agoraphobia may actually be quite mild. They might experience a little bit of anxiety about being in certain situations, but they might be able to cope with it if there is someone trusted with them and they are able to, like if somebody who has the fear of being in lifts will take a friend or somebody along with them, and then they will actually face the situation, but they will need that constant reassurance and somebody has to be with them. But in some cases it is so debilitating that even reassurance or even the constant assurance that somebody is going to be there with them, even if there are 10 people saying I will be always around you and we will help you in this situation, they are still not able to overcome the anxiety, and in these kind of cases it becomes a chronic condition. Now if these things are transient, again we don't diagnose them as agoraphobia. This have to persist for a period of months and only then agoraphobia is diagnosed. So again, in these kind of situations, if you are experiencing this or you know somebody else who is in a similar situation, then please do insist that they meet a psychiatrist or you take them to a psychiatrist, because these conditions come under the spectrum of anxiety disorders, and once we treat the anxiety, the person starts feeling better and we can help them to resume their normal life before the illness set in. So please do pass on this video to others where you feel that this information would be helpful to them. And if you have any questions or comments, please feel free to write in the comments below and I will get back to you as soon as possible. Until then, always remember to be kind to your mind. Thank you.